Hi, good morning, everybody. Starting here in Germany, in Berlin, in our studio in the morning. I want to welcome you to our co-host session with the Japanese team. So we are live from our studio in Berlin, and I have two guests that I want to have a conversation with. They're both from Berlin, although they're not born in Berlin, but both are located here. And I want to kick off with someone whom I had on my stage, one of my events that we produced in the past, Bart de Witte. Bart has been involved in corporate innovation for a long time. He was heading the digital health unit at IBM. He's been around for 20 years, and in the past months, more or less, left the corporate environment to actually focus much more on innovation and community-based activities using exponential technologies like AI and others. And I want to say hello to Bart. Good morning, Bart. How are you?
Good morning, Stefan. I'm doing fine. Thank you for having me. We're probably like 1 kilometer away from each other, but
absolutely. Yes. Good morning. I want to use our like 15 or 20 minutes, Bart, to get a little insight from a German perspective. And one thing that reminded me of a conversation we had a couple of days ago was the fact that looking at the numbers, some people say the numbers in Germany are so low. Let's start with that. I know you're not a data scientist, and you are not. We can only look at the official numbers that we get from the Robert Koch Institute. Do you have an idea on that?
Well, I think we have to look at the measurements, and if you look at the measurements, each country is measuring differently. For example, even by law in Germany, there is no obligation to do an autopsy report when somebody dies within a hospital. That probably has an influence on the data that is being collected. We also have different characteristics, like the number of ICU beds in Germany are quite different. We have approximately 30 ICU beds per 1,000 citizens. In Italy, that is 12. So then you have the age of the population, which is quite different. Italy has a very old structure compared to Germany. It's not that far, but we have different characteristics. And to put it all into a model that we can compare these countries with is difficult because we have different measurements. So there is no standardization. There's a lack of standardization, which leads to a non-comparable data base that we are now trying to compare, and leads to wrong conclusions.
Okay, that might be one of the reasons to do this. And looking a little further to the activities that we saw in the previous session in Estonia, there was a hackathon. What's going on in Germany on that side? Maybe you can give us a little insight for the rest of the world. What did we do?
Well, Germany this weekend had two large hackathons. One was organized by the government. 43,000 people participated in 2,000 projects over 48 hours, which is an unseen dimension. Then there was a hackathon organized by my friend Elena Puglia from Data Natives. She organized a really focused data-driven hackathon where it was more international collaboration. The participants came from everywhere within the world. So there's a lot of things you see happening, people taking initiatives. I don't like the element Germany versus Estonia. I think we have to be collaborative and not always put the nation next to an initiative. But there is a lot of things happening. People all want to help, people all want to collaborate. And this is our time to create open collaborative environment.
And so, tell us a little bit about what your activity is. You're working on a global community, and you actually kickstarted that only a couple of weeks ago around that topic here right now. And you see an incredible power of the crowd coming together. Is that, maybe you can describe a little bit what's going on there.
Yeah, I was in a conversation with a friend of mine in California, and we analyzed, okay, what are the three major problems? And one is the availability of tests. The other one is the availability of ICU beds and the medical supplies that come around that bed, or the supplies. And then the third one is the human resources. And we started, and it was 2 weeks ago, a friend of mine, Guy Calanzati, who is based in California, Berkeley. He started a Facebook group. We set it up. We were doing some branding. And now 2 weeks later, that has become a group of 40,000 people collaborating on innovative medical supplies based on 3D printing, open source design, trying to build a ventilator, which is a very complex machine that you need. Out of that, a lot of projects have been derived. There is the open source ventilator project in Ireland. There are so many projects that have been started within the last couple of 2 weeks. But as I'm not an engineer and my focus is more on software and the platform, I focused on the third component, which is the human resources. And we did a lot of research, and we analyzed that these human resources have quite a lot of issues within their private life. And so they're organizing their kids, organizing their purchases, organizing all these things. And we scraped the internet and the social media reports that came out of China and Italy, and we tried to find then, okay, what is that what we can do to help our heroes? So we created the hashtag myheroes.global initiative last week. Within a week time, we are working with a core team that come from 6 different European countries. We are doing daily calls. We're talking about social distancing, but I've never felt so social in the last 2 weeks. I've been connected all the time with people I've never seen, and we are building solutions that are focusing on helping these frontline workers to have an easier life so they can focus on helping us.
So if you take that momentum right now, and you mentioned the government being open to actually do a hackathon in that way that we haven't seen so far. Isn't that the first, looking at the transformation that's happening, and we've been discussing this in the last couple of years. There's, people talk about exponential technologies, that are disrupting businesses. The need of change on this side of the government as well, and especially government is pretty slow. So it seems that government was pretty open to be agile for the first time, and understanding that it's really about speed. How do you see that? Is that changing, or is it just a first attempt and they watch it and they want to, maybe they learn from it? What do you see? Do we see change on government side as well? Because it seems all about like, how fast can we act? How can we work on supply? How can we do it faster? And usually, especially Germany, because of the federal system, we have very slow decision mechanisms. It takes quite long to take one decision, right? How do you see that playing in right now?
Well, yes and a no. Like we already here in Germany, we have a health minister that is very agile and has created something what he called agile politics. So he created the Digital Health Act that came into place beginning of this year that allows physicians to prescribe apps. That's the first country globally that where this happened. So we already have a very innovative Ministry of Health. On the other side, we are confronted with very local federated structure. So healthcare is not organized on a federal level; it is within the state level. So, and it is a combination of very hierarchical organization that are influenced by politics. So what I've seen as well happening is that there is a miscommunication, and people within my environment had to take a lawyer, and some people were threatened to be fired because they were whistleblowing information of situations that were happening. So there's a combination of, yes, there is a lot of people that want to help, and there is on the federal level, a minister that really understood the power of this kind of collaboration. On the other side, we are confronted with very old structures, with hierarchies, with an organization model that lacks agility, and these different hierarchies lead then to a kind of Chernobyl kind of model in terms of communication, where the information that you would need to take decisions on a federal level is not coming in the right place. And it's always biased in terms of the interest of these people that are involved. And I'm probably going to be criticized by telling this, but I've done with the team quite direct research on this. And I think we need to break open these organization structures to get that innovation at the front end.
And also, I think, isn't it a great opportunity for these organizations, and maybe not, let's not mention only government, but general organizations, let it be nonprofits, let it be any other organizations, to see what that speed and what technology speed and community power can actually produce and help. If you look at the hackathon, and I don't know what the output is, coming from the hackathon, the government, but what aren't these good examples on how to act, in the future on on similar occasions that we have? Because there's always like, you need to prove, right? Do you have a case? Can you show what's going on? I think now is an incredible time to show and give examples that you can do these things within such a short time.
Yeah, there's a combination of a vision, setting a vision, and the vision is here to manage the issue that is threatening all of us in our society. So I think what is different here is that everybody's guided into one single direction. And that is mostly the problem of open innovation, that if you don't set the vision, what you want to reach, then you have 10,000 different ways to follow a direction. And that's what mostly happens. So I'm happy that vision is not driven by any political interest or economical interest. It is threatening our society. So I think that's the big difference. And what we would need after this crisis is visions and desirable futures that we want to live in. And I think if you look at our visions that we have on a governmental level or even on a corporate level, that was lacking. And I think that's what we have started to do as well in different organizations where we working with a lot of futurists, is to drive this vision building towards a future that we want to live in. And now that vision is being driven by fear, by a more aggressive element that is creating a threat to our society. But I hope that after this crisis, we are learning from this, that if we set a joint vision, that we then all start to collaborate. So it's not only the models of collaboration, it's also setting the vision.
Sorry, but isn't that a hard thing? Isn't the setting the vision, if you look at a federal system that has 10 plus federal states, and of course we have a Ministry of Health that is pretty innovative, which is true for one of the biggest countries, economic powers in the world. I'm always trying to understand what could be a format, what could be a way to actually get those people together at one table, because we're all sitting at one table now. It's about addressing an urgent need in a crisis. And once we are out of that mode, isn't the danger that everybody goes back to that old mode, or what do you think?
Well, I think we started to develop that vision 300 years ago when the Enlightenment started, is giving access to free information. And if you see my business, where I've been in healthcare, it's always driven partly by intellectual property and protecting property in that sense. And I think what you know this from our conversation. So I've been driving the Hippo AI Foundation that is focusing on open sourcing medical AI, because I think medical knowledge should be accessible to all. And I think data monetization schemes in healthcare should be absolutely avoided, because it will drive us into a more divided world, and it will decrease inequalities. It will increase inequalities in health. So I think that's the challenge. Like, where do you collaborate? And if people are afraid of giving up on something, but if you see what open source did, if you open source your properties, you create an economy on the experience level. And I think what we are missing in healthcare is experience. So we should not be afraid of letting go of IP. We should open up. We're doing this in generica, a drug development, or not drug production. So we should create more and more of these movements and try to kill IP and then create a better experience on the healthcare care level.
Okay, thanks, Bart. That's a very positive side, given the fact that the world around us right now is more scared and people are in fear. There's different levels of fear, and I will address this in the next session with Master Adli, who will be joining in a few seconds. Bart, thanks so much for joining us this morning. Stay healthy, everybody, and if people want to get in touch with you, everything here will be recorded and people can see that session even if they missed it today. So thank you so much, Bart. And I'm